Hello, everybody. Welcome to our class on body organization. Today, we're going to cover general principles, general concepts about anatomy, and I'm going to try to give you the tools for you to be able to memorize and understand anatomy in a much simpler way. Most of the time, anatomy has these is famous to be a hard class. It's famous to be hard to memorize parts because many times the students are struggling knowing the names of the structures. Sometimes when you see models or when you see pictures of anatomical structures, sometimes they look different depending on which model you're looking, which images. And the truth is that you really need to have a very good base, a very good understanding of the very general things in order to have a good way to identify structures when you master these basic principles. So we're going to cover today first what is the anatomical position, why anatomical position is important, and why we take these as a reference always when we look um, either anatomical models, when we look medicine images, when we look, for example, an X-ray or a CT scan or MRI. We most of the time we take the anatomical position as a reference point. Then we're going to cover the major regions of the body, regions and quadrants in the abdomen. We're going to see there that the abdomen overall is one of the more complex regions of the body because it contains many organs that belong to different systems. For example, in the abdomen, we can find organs that belong to the endocrine system, organs that belong to the digestive system, organs that belong to the skeletal nervous system. So the abdomen is the hardest part for sure to identify and learn structures. Now, before we go to all these portions, I want to give you that, the better and the more simplest way how you need to approach anatomy in order to understand anatomy and in order to memorize things in a better and easy way. First, let's look at the anatomical position. The most important part here, after you read the concept, what is it, just pay attention in what happened with the hand and especially with the palms. In the anatomical position, the palms are facing forward. That is, I will say, the most important part. And just keep in mind that we always use the patient bodies as the reference. What I'm trying to say here is that always the right and the left, when we study anatomy, is going to be the right and left of the patient. If we take an X-ray of this person, we're going to be able to, for example, we have two kidneys, right? So we have one here and one here. So in order to determine which kidney is the right and left, we need to use the right and left of the patient. In this case, this is the right side of the patient, this is the left side of the patient. This, therefore, will be the right kidney. It doesn't matter how the person is, in which view we're looking at the patient. For example, this is an anterior view. You can see here, anterior view. You have to get familiar with the name of the view. Most of the time we call these, the front, but in anatomy we use anterior, posterior to describe the back. And we use other views, lateral, superior, inferior, we're going to see next. But just keep in mind that it doesn't matter how you see the patient. The right always will be based on the right or left of the patient. If you look this image here, we're looking at the patient from the posterior view. And in this case, where will be the right side of the patient? Pause the video and try try to tell me where is the right side of the patient. Well, the right side of the patient in this case is going to be here, and the left side of the patient is going to be here. So always the left and right of the patient. If we have an image of a kidney, but if we know that the patient, that the image that we're looking at there is in a posterior view, we're going to be able to understand that this is the left kidney. Imagine that if we have that same image, like in this square, if we have the same image, but is an anterior view, now because it's an anterior view, this kidney is going to be the right, and this is going to be the left. So sometimes it's important, those are just examples that sometimes are useful to know, especially if you are in the radiology program or if you're going to see images. You have to essentially master this concept of anterior view, posterior view, cross sections, lateral view, to be able to determine what is right or left, especially with organs like kidneys where we have two. Now let's review those types of view that I just mentioned briefly a few minutes ago. Now this is crucial. If you need to invest time to be able to recognize part and to understand what are the views, you must be an expert in this in order to be able to understand anatomy. Why? Because you will see that there are structures in your body that we're not going to be able to see them unless we use a specific view. So it's crucial that you master these. This is one of the things that you need to know to create a very good base in your knowledge to understand anatomy. Part of the anatomy, of course, is memorization, yes. We have to memorize new names and all that, but more than that is really don't you know don't make it's really about having a good understanding and having a good base to be able to recognize what are you looking, where's the view, and in which way you're seeing stuff in order to learn them. So we're going to start with a pretty easy one. We're going to do the head as an example. As you remember, we just mentioned before, let's just define what is the right and left of the patient. This is going to be the right side. This is going to be the left. And the right side, we still have the skin. I just keep the skin here so you are familiar with what we're looking at there. And then the left side, we remove the skin, we remove the muscles, right? So you can see just here the bones and part of the eye. That is the face. That is an anterior view. Next one, we have a lateral view. Now, when you have a lateral view and you look here, which side of the body we are looking at here, the right or the left? Pause the video and ask yourself if this is the right or the left. All right? If you pause the video, I'm going to tell you that this is the left side of the patient. All right? Remember that always we use right and left to define. We always are based on the patient. So this is how it looks like. Now, this is a lateral view. You will see that in order to memorize some of the bones, like this bone, the frontal bone, sometimes is very useful to have a lateral view. We have this other bone here that you're gonna get familiar. This is commonly called the lower jaw, but in anatomy we call this the mandible. The upper jaw is called the maxilla. Now I'm saying some names here because we're gonna learn these later in this chapter, but you would have to know that this is the mandible and the maxilla. Now the frontal bone, also we have another bone. The frontal bone is the more anterior bone. See, anterior, why? Because it's the bone that is more in front. What is the name of the most posterior bone? Well, that is the occipital bone. So you can see here in the lateral view is very important to define, to be able for you to recognize. Now these probably, I mean, I can hear yourself saying this is pretty obvious, but really you will see that their organs or their other views, they are more complex. These, I just choose this one because it's very simple. It's something that you can easily picture, and then easily you know what we're looking at here. But you will see later that there are other structures that are not quite obvious, and these, when we mention lateral view, it turns tricky. So just don't underestimate these, the importance of knowing when we're looking something in an anterior, lateral, posterior view. The next one here is what? A posterior view, right? If this is a posterior view, of course, we have these, the ear. This will be the right ear, and this will be the left ear. Now, we mentioned two bones here. Which bone, therefore, is this one? We mentioned that the bone here is the occipital bone. This is how the head looks from the posterior view. Now, let's look at the superior view of the head. All right. So look in the superior view, how big look the frontal bone now that we're looking at this bone from the superior. When we look at this bone from the anterior or the lateral view, it didn't look that big. And that is the thing. Most of the time in anatomy, you're going to have pictures like these. There are two-dimension pictures. The goal of anatomy is that you mentally form a three-dimensional picture of any structures in your mind, and realize how big or how small are the structures. Anyway, so if we look this superior view, we have the right side, we have the left side. We have two bones here. For example, we have, this is the parietal bone, and we have another parietal bone here. So this is going to be the right parietal bone, the left parietal bone. This bone here is the frontal, and if we look the anterior, posterior, this is the anterior part of the patient, this is the posterior part of the patient. We have the right side, we have the left side. This is a superior view. Now we have the last one, and this is going to be what view? An inferior view. All right. This is very important, especially if you're going to if your goal is to enter into the radiology programs, because many of the x-rays, many of the CT scans or MRIs, when we have the patient, many times we use this inferior view when we have images. So it's very important you get familiar with this. Always, when we have a transverse cross-section, we're going to see that in a minute, why that is important. But most of the time, transverse cross-section, we look at the images from the inferior view. So in this case, we will look at in this direction. You know now that this is the right side, this is the left side. Why this here is quite obvious, but you're going to see that if this will be the abdomen, sometimes we're not going to see, especially with the abdomen, you will see that when we have structures like kidneys, if we have a kidney in one side and another side, it's crucial, do you know which view you're looking? Because if you think that this, if we look at here, if you think that this is a superior view, you might think that this is the left side if you think that you're looking at the kidneys from the superior. If you know that you're looking at the kidneys from the inferior view in this scenario, you know that this is the right and this is the left. But don't worry, we're going to see more examples of these later in this class. But to have the ability to understand which view you have is a good, is the best way how you can start learning anatomy. Now, I have a rule for you. Do not learn anatomy based on colors or textures. This is one of the major problems when students, or this is one of the things that make students struggle when they just get familiar and they get, you get confident with one specific shape, with one specific color, or with one specific structure. Now, I put these apples here just because it doesn't matter how they look. You know that this is an apple, right? You know that this is the real apple. But if somebody make a sketch or something, or if I show you this in an exam and ask you what organ is this, or in this case, what fruit is this, you will know that it's an apple. Even if I put the apple in a rare color, it doesn't matter. You still know that an apple is an apple. So that is the ability that you have to have in anatomy. When we learn about organs, don't learn that, or don't get comfortable learning the organs according to the colors. Basically, in anatomy, you need to learn shape and location. We're going to see that in a minute, but this is the rule. Don't think about learning organs by colors or textures. Look at this example. This I have here two organs, all right? This is the kidney, and this here is the adrenal gland. So it doesn't matter the way how you look at those. We use models. We use pictures. If you look here, all of them are the same thing. They might look different in terms of color. This we use a darker brown. This we use another. But this is the thing. You need to practice in your head to create a very simple picture of an organ. This is my suggestion. Keep this in mind when you try to learn anatomy. Learn anatomy and structures based on basic shapes and locations. Now, let's focus first on basic shapes. Now that you saw those pictures behind, you might recognize that this is the kidney and this is the adrenal gland. So that is the part that it looks obvious, but you will get surprised how much it helps to identify the structures if you have this mental picture in your mind of something more simple. What organs do you think is this? Well, we're going to see later that this is the liver. And the liver, most of the time in models or pictures, is also brown. We have just only one liver. We have two kidneys. The liver is pretty easy to identify. This shape, this is another thing. They're going to be organs that are pretty easy to identify based on the shape that they have. Look at the stomach, right? This is what you need to work on your mind. Be able to recognize organs. Try to find just the basic shape when you see a picture. Let's use this as an example. Now, many times when we learn anatomy, we will have to use those cross sections that I mentioned before. In other words, in order to be able to see structures that are inside, we're going to need to cut parts of the organs or structures in order to see them. Now, look at all of these images. You might think all of them, they look different, but really, they are showing the same thing. Now, if we just practice this concept of learning basic shapes, what is the easy landmark you can find here? I would say, well, if we look this structure, it's pretty easy to find it pretty much in every image. Well, maybe this not here, but in this image, we don't have the cerebellum, which is the name of the structure that is here, but it will be there. All right. Sometimes that's what happens in anatomy. Sometimes you will not see parts of an organ, but if you have just the general idea, you will know that based on these, you can deduct that they remove that organ from this picture, and that organ will be here. What else you can see here that is very unique? This portion here, right? That is called the corpus callosum. You don't need to memorize that right now. You're gonna see that later in the class. But this is the point, that you need to have just to find just basic shapes. So when we ask you in the exam, you don't get troubles if you see an image that that just look slightly different. Let's translate some parts. All right. What about this one? This is a gland. It's called the pituitary gland. Can we see the pituitary gland in this picture? Pause the video and try to tell me where is that pituitary gland in that picture here. Okay. If you find it, this is the pituitary gland. Right? Can we find the pituitary gland in this one? By the way, this image is a real image. It's an image of an MRI. So if you're in the radiology program, you see what is the importance of knowing anatomy, because that's how we interpret images. What view do you think is this? Okay, it's a lateral view. Which side of the body will be that if this is a lateral view? Well, it is the left side. Now, let's go back to the structure. Can we find the pituitary gland in this picture? Pause the video again and try to find the pituitary gland in this image. Right? If you pause the video, the pituitary gland is here. You find the pituitary gland in this one. Pause the video again and try to tell me where is it. Right? In this scenario, we don't have the pituitary gland. They do not draw the pituitary gland, but if they do, it will be somewhere here. Okay? Let's practice one more time. We're going to do another structure. Again, this is just practice. You don't need to memorize the name of these structures yet, but what I'm trying to do here is for you to get this skill to translate and be able to find the structures even though the image might look different. All right, we have a structure here. It's called the thalamus. This area is called the thalamus. Can you find the thalamus in this other picture? Pause the video and try it. Right, the answer is this. This area here will be the thalamus. Can you find the thalamus in this one? Well, in that scenario, the thalamus will be this one. And in this one, the thalamus will be this one. All right. Other structure that is pretty easy to look, find here is the pons. All right. This structure here is called the pons. Can you find the pons in this image? Oh, is this one. Can you find the pons in this image? Is that one. Now let's try to find the pons in the real image. I'll give you a few seconds. If you say this one, you are correct. That is the way how you should be able to train yourself. Do not get comfortable with the specific colors, with the specific textures. Get comfortable with specific shapes. This is another example. This is the image that I want you to have in your brain. All right, this is what you need to look for. So you see, this is the very basic shape of the cerebellum. See, this structure here is the very basic shape of the corpus callosum. This is the pons, which is this one. Now, where is the pituitary gland here? Can you find it? If you didn't find it, it's because they didn't draw it, but it will be somewhere here. So this is what you need to practice. This is what you need to have in your mind. Other suggestion that we're going to see in just a sec is locations, but keep this basic shape in the back of your head every time you're trying to learn anatomy. Now, here's the problem with anatomy. With trying to learn anatomy, sometimes you get comfortable when we show you pictures of organ systems like this. The reason why we do that is because we want to show you, each individual organ. But the problem here is trying to get comfortable thinking that, in real life, you will find the organs like that. So the thing is, you need to know that in your body, everything is packed, everything is mixed together, and you should be able to mentally try to translate or just to try to put all the organs together. Like if we want to draw the lungs, where the lungs will be here. Well, there will be somewhere here. There will be somewhere here. The trachea will be somewhere here. Where will be the kidneys? Here? Well, they will be here. Where will be the kidneys here? Are the kidneys in front of the intestines? Are the kidneys in the middle of the intestine? Are the kidneys behind the intestines? That is locations. This is the thing that you need. This is the second skill that I'll try to work with you to get this skill, to be able for you to get familiar with locations. The first one was general and basic shapes. The second important part or secret to learn anatomy is to get familiar with locations. Now I have the two pictures here. You might see this silly, but this is what, just think about this. You're very familiar with what is here, right? Are you familiar with what is here? What is the name of each individual organ? If this is your first time taking anatomy, maybe not. If this is the second, probably you are able to tell me the majority of the structures. But I bring those two pictures to contrast something here, just to show you a point. Now, if I ask you, what is this? Can you tell me what is it? Well, you probably know that this is a banana. Can you see the entire banana there? No, you just see a part. But you know that it's a banana just because you saw that the bananas millions and millions of times. Can you see these? Just can see just a part of the bread, but you cannot see the entire bread. So in anatomy is the same thing. We have structures that in order to be able to see them, you can see just a part of them. Sometimes they're covered by other organs, and that's when the location is important, right? This is when the location is important to learn anatomy. Imagine that if we want to know what is underneath or what is below all these here. Well, how we do that? We will need to remove the orange. We will need to remove the wine. We will need to remove, what is that? I don't even know. Pomegranate or something. We're going to remove all the grapes, and then we're going to be able to see something inside. What is it? Well, the same thing here in anatomy. We have, for example, the abdomen. You can see here that in order to learn anatomy, we'll need to do dissections. We will need to remove parts in order for you to be able to see what is behind or underneath or on top. So in here, this is an anticipation, but it's pretty good that I'll tell you what is each individual thing. We're going to review the organ systems later, but it's good to know it already. So for example, we're going to see that this is your chest. This also is known as the thoracic cavity. This is your abdomen, all right? So there is something here between the thoracic cavity and the abdominal cavity. This is a muscle. This muscle is called the diaphragm muscle. The diaphragm muscle is a muscle that divides the thoracic cavity and the abdominal cavity. Now, we have an organ in the thoracic cavity right in the middle. that is the heart. We have two lungs. What lung is this? Is this lung the right or the left? Yes, it is the right lung, and that's the left. What else we can see in the thoracic cavity? We have two big blood vessels here. At this point in anatomy, you just need to memorize two structures, which is one artery and one vein. This in red is the aortic artery or aorta, and this here is the vena cava. Those are the only two blood vessels you need to know at this point. So lungs, heart, aorta, vena cava, right lung, diaphragm. Then we have more superficial, this big organ. Now, I showed you this organ before. Do you remember what was the name of this when I was telling you about the basic shapes? Well, if you remember seeing something like this, with a little thing here, that is the liver. It's part of the digestive system. We have another structure here in green, the gallbladder. Notice that besides the liver, we have the stomach. Now we cannot see the entire stomach again because it's covering partially by the liver. This is the large intestine and the small intestine. Now let's look at this same, not the same model, but let's look at something very similar now with less parts. We're going to remove some of the organs to see what is behind them. Here's when anatomy starts getting tricky. Here's when this is the portion in which students struggle. All right. First of all, is this image, do you think, is this the thoracic cavity or is this the abdominal cavity based on this picture? Well, if you just try to look for landmarks, try to look for things that are very easy to identify. In this case, the intestines are very easy. So we know that this is the abdominal cavity. So we are now seeing almost nothing of these in this picture. Now, we might see something. What do you think is this little portion here? If you say the lungs, it's correct. We're seeing this little portion. What will be this little portion here? If you say the diaphragm, you're correct. That's the diaphragm. Now, of course, we remove some organs. Which organs we remove there? Well, just look at this easily first. You see this portion here in this image, that is the transverse colon. It's part of the large intestine. We obviously cut that to show you some portions, right? So we cut this portion of the colon. What other two organs we're missing here? Pause the video and try to tell me what organs we're missing. Well, the first one is the liver, right? If we want to draw the liver will be somewhere here. What other organ we're missing here? Well, we're missing the gallbladder. We'll remove the gallbladder. And then finally, I told you about this organ. What is it? The stomach. So the stomach will be here. So you see, that is the way how we sometimes in anatomy, you have to realize and you have to have this kind of location in order to understand where you're looking at here. So in order to see what organs are behind the liver and the stomach, you have to remove them. Now, when you remove them, you can see a few organs here. We have this organ, which is called the spleen. Keep in mind that the spleen is always besides the stomach. If we draw the stomach here, the stomach will be here, and it's besides the stomach. You might see, if you have the stomach, sometimes you might see just a little portion of the spleen, but not all the organ, because in order to see the entire organ, you need to remove the stomach. What other organ is going to be important? The pancreas. The pancreas is this organ that is kind of in the middle of the abdomen. Most of the time when you see glands, like the pancreas, for example, it has a portion that produces hormones, is a glandular organ. Always they're going to look like yellow fatty tissue. So this is the diaphragm, this is the pancreas. What else we can see here? Well, small intestines, large intestines, a spleen. Now let's look at it here. All right, we have something here. Now, at this point, I'm not expecting you to tell me what is that, but in some point, we're going to learn the urinary system and the endocrine system. Keep in mind that the things that we can see here are an organ. Now, I'm going to show you next a picture of what those two things are once we remove everything from there. So let's look at that next. Here we go. Well, can you tell me what is this? I told you in the past when we practiced the basic shape that these are the kidneys. This is the adrenal gland. Now, see now when you try to translate that to this point. If in an exam I ask you for this, you might struggle. You might have trouble to telling me that that is the adrenal gland. Which adrenal gland? The right adrenal gland, because this is the left one. Now, that's what I'm saying. Don't get comfortable just with one picture. And because if you apply the two concepts, basic shapes and locations, you're going to be able to tell me what organ is no matter which image I'll show you, or no matter what image I present to you. You can see just based now that the kidneys, you can realize that the kidneys are organs that are way back. You see that this is the front of the body, this is the more anterior or more superficial part. See that the kidneys are way deep. In order to see the entire kidneys, you need to remove essentially the entire intestine, pretty much everything. And then you're going to be able to see the kidneys with the adrenal glands, with the ureters, and the aorta, vena cava. So this is a classic example where you can see why it's important to keep in mind basic shape and location. Don't get comfortable with colors because the colors might change, or textures. See, these might look a little bit different than this one. If you get comfortable with that, in the exam you're gonna have problems. But if you follow my recommendation, you're gonna do good no matter which picture you get. You're gonna be able to recognize what is it. All right, the next thing we're going to talk about here is going to be the anatomical planes and the cross sections. So this is another thing that is going to be super important for you to be able to recognize the structures, because in anatomy we use these a lot. Why? Because otherwise we will not be able to find or see structures unless you cut the human body. So we have three major anatomical planes, and sometimes we call these as synonymous once we cut the body or when we use models as the cross sections. So we have three. We have the sagittal plane, which sometimes we refer this when the body has been cut in sagittal cross section. We have the frontal or coronal plane, coronal cross section. And we have the transverse plane or transverse cross section. So we have those three. Your goal is to be able to recognize which planes or which cross section we use in order to see, or just to tell me what structure is that. So sagittal cross section, we cut the body in a half. We separate both halves. We're going to have right and we're going to have left. If we cut the body in a coronal cross section, we're going to have two pieces. One that is going to be anterior, the other is going to be posterior. If we cut the body in a transverse cross section, we're going to have superior half and inferior half. Let's put in practice this concept of sagittal plane or sagittal cross section next. All right, I have this picture here. You have this frontal, transverse, sagittal. You have an image of a brain, right? I'm going to tell you that this is a lateral view of the brain, right? You're looking at it here, the right side of the brain. You know that, therefore, you will know that this is the front, or remember in anatomy, we don't use front. This is the anterior. This here will be the posterior part of the brain, right? And this is a lateral view. Now, based on that, what cross section do you think is this? Pause the video and tell me, is number 1, is number 2, or maybe number 3? What do you think? All right, if you pause the video, the correct answer is number 3. This is a sagittal cross section of the brain. So what we did is we cut the brain in this direction, we remove this part, and then we can see the internal part here. Therefore, this half of the brain is the left half of the brain because we remove the right half of the brain in order to see inside. Let's practice with this one. Frontal, transverse, sagittal. What do you think it is? 1, 2, 3. Right? If you say that this is number 2, that's incorrect. Number 3, transverse plane or transverse cross section. What we did is we cut the brain in this direction. We remove all that, so we take that off. And now we're looking at here this part of the brain from a superior view. Remember the importance of knowing superior view, anterior view. This is a lateral view. Well, this is a superior view. So essentially, if you look the lateral view, essentially, we are looking at the brain in this direction. Imagine this is your eye, and you're looking at in this direction, right? If this is the anterior, this will be the anterior part. If this is posterior, this will be the posterior part. But this is the superior view, and this is a transverse cross section, right? So that's the way how you're going to practice and get familiar. So if I tell you that in the brain, this lobe of the brain is called the frontal lobe, what will be the frontal lobe here? Do you think it's this one? Do you think it's this one? Do you think it's this one? Yes, that is the frontal lobe. If I tell you that this is the occipital lobe, you should know that this is the occipital lobe. If I tell you this is the lateral lobe, or the temporal lobe, this little portion here will be portion of the temporal lobe. Let's do the last one. Well, you probably know now that we reviewed sagittal, we reviewed transverse. This must be a coronal cross section. Now, the brain in this direction, this part, take it away. Now we're looking at this portion here, right? So this, which view do you think is this? Think about it. This is an anterior view. This is a coronal cross section, right? So if you know this is an anterior view, you must know that this is the right side and this is the left side. In this lateral view, this is the temporal lobe. In the anterior view, this is the temporal lobe. Now, this is the right temporal lobe. This is the right temporal lobe. You can see here the cerebellum. Now, you can see just part of this in the lateral view, but in the anterior view, you can see both. You can see this here and you can see this here. the cross section is the coronal cross section. Okay, let's moving on. Now let's talk about the term axial and appendicular. This primarily, we're going to use this when we study the skeletal system and the muscular system. You will see that most of the time when we study the skeletal system, we divide the body in axial skeleton and appendicular skeleton. I want you to get familiar with the term appendicular because this refers to the extremities. So the upper and lower limbs is the appendicular skeleton. The axial skeleton is composed by the cranium, all the vertebral column, the sacrum, the coccyx, all the ribs, and all the thoracic, essentially the rib cage and the sternum, which is a bone that is here, belongs to the axial skeleton. Now let's talk about briefly about the most important anatomical directions. The term right and left, we discussed this already, so I'm not going to spend more time here. Now, I want you to introduce the term medial and lateral. We are going to use these a lot in the lab, but also in the lecture. And it's important that you know that every time that we talk about anatomical directions, when we try to define what is medial or lateral, most of the time we're going to compare one thing against another. But let's begin by the simple term midline. So in order to have a midline, we have a line in the body. This is an imaginary line that divides the body exactly in 50-50, right? Half and half. So that is known as the midline. Now, any structure that is closer to the midline, that is the reference point, is a medial structure. Everything that moves away of the midline, that is considered as a lateral. So how we can apply these, or how we use these, or how we ask this in the exams. Let's take as an example bones. So we have here in the forearm two bones. We have the ulna and we have the radius. Now remember that this is always based on the anatomical position. So the ulna in the anatomical position always is going to be medial. The radius always is lateral. And the radius is lateral because we are comparing that against the ulna. And vice versa, the ulna is the medial bone of the forearm because we're comparing against the other bone of the forearm, which is the radius. So in that scenario, the ulna is the medial bone of the forearm, the radius is the lateral bone of the forearm. Let's take as an example the leg. So here in the leg we have two bones as well. So we have a big bone here, which is called the tibia, and we have another bone here is called the fibula. So because we have two bones in the leg, in order to define which is medial, which is lateral, we say that the fibula is the lateral bone of the leg because we have another bone in the leg that is more medial than that. So therefore, the fibula is the lateral bone of the leg because it's the farthest away from the midline if we compare that against the tibia, which is closer to the midline. All right, let's move on to the term superior, inferior, proximal, and distal. Now, this is important that we only use superior and inferior when we refer to this, when we try to compare structures that are located in the trunk or the head. So, in other words, we use superior and inferior for the axial skeleton or for the axial body. Now, we use proximal and distal for the extremities or the limbs. So that is the same to say that we use the term proximal and distal for the appendicular skeleton. Now, why we use that and how we define what is superior and inferior. So again, we always compare one thing against the other. So for example, let's take this simple, the eye and the mouth. So I can say that the mouth is inferior to the eye, or I can say the same thing, that the eye is superior to the mouth. That is pretty easy, pretty straightforward. The nose is superior to the mouth, but the nose is inferior to the eyes. The nose is superior to the mouth is inferior to the nose, and the mouth is inferior to the eyes. So that is pretty easy. Now, with the extremities, with the arms, we always use the term proximal and distal. We never use the term superior or inferior in the extremities because that sometimes can change. Let's use as an example the bones. So we have a bone here, it's called the humerus. This bone articulates with the scapula here in the shoulder. And remember, we have the radius and we have the ulna in the forearm. So in this particular position, we can say comfortably that the radius, which is this bone, is inferior to the humerus, which is the bone here in the arm. Now, however, if this person is, let's say that she lifts her arm, now the hand is here, right? And then we have the radius here, and then we have the humerus here. Now we cannot say that the radius is inferior to the humerus, because if you can see, now it's actually on top of the humerus, so that change. Now, because that happens, that depending on how the arm is located, we don't use the term proximal, the term superior and inferior. We use proximal or distal. Now, how we can define what is proximal, what is distal? We use the trunk as a reference. Now, we're going to see in just in a minute, when we start reviewing the regions of the body, that this portion here, which is the chest, the abdomen, and all these, the pelvic cavity, all this is known as the trunk. So everything that is closer to the trunk is proximal. Everything that is away of the trunk is distal. Now, the humerus, for example, is closer to the trunk than the radius, not by the fact that they are, in this location. It's just by the fact that the humerus is actually touching the trunk in the articulation part. So because the humerus is actually the bone that articulates with the trunk, always, it doesn't matter how the arm is moving or how the arm is located, always the humerus articulates with the trunk. Therefore, the humerus always is going to be proximal than the radius. If we look this bone here, the tibia and the femur always is going to be proximal than the tibia, because the femur is the bone that actually articulates and with the trunk. So the femur in this case is proximal and the tibia is distal. And then the other terms that we already know is anterior, posterior. Remember, anterior is in front, posterior is the back. Okay, before we review all the organ systems, we're going to review all the regions of the body. The best way how I recommend you to learn this or approach to this is start from the big and then from big to small. All right, so the more broad and general regions to the more specific regions of the body. We have essentially 5 big regions of the body. So we have um, are this here. The cephalic region. Cephalic region is the region of the head. Cervical region, as you can see here in green, represents the neck. Trunk, we just talked about the trunk a minute ago. That is the reference point that we use to define what is proximal and what is distal. Upper and lower limb. All right. So now we're going to review what are the regions or the subregions of the cephalic region. Later, we're going to review the trunk. The trunk can be divided in smaller regions. The same thing for the upper and the lower limb. The only region that remains the same is the cervical region. The cervical region is just the cervical region at this point, and that's it. There might be another regions, but for you just need to know that the cervical is the cervical. Now, the cephalic region can be divided in cranial and facial region. You see here in blue, facial region is the region of the face, and cranial region is the region of the cranium, which is the top of the head, laterally here in the head, and all the back, right? That is the cranial region. The cranial region can be divided in occipital region, frontal, temporal, parietal region, but for your exams and for AP1, you don't need to know those. However, you need to know these divisions of the facial region. These subdivisions of the facial regions are the next ones here. So we have a frontal region. Now, you might ask yourself, well, you just said that the cranial region has a frontal region, and that is true. This frontal region is shared with the facial. So this portion is the frontal region of the cranial region, and this one here is the frontal region of the facial region. So that is kind of this frontal region is kind of shared between the cranial and facial region. Essentially, you can think about this frontal region in the face where we don't have any hair. So it will be like the forehead. And then when you see hair, especially in this portion where the hair starts, that is the frontal region of the cranial. Now we have in green orbital region around the eyes. You can think about the orbital region. The name orbital comes from orbiting. Like if you think about the sun and the planets orbit the sun. So they make like a circle around the sun. So in this case, orbital region is the region that orbits the eyeball. So that is the orbital region. The name of the frontal region comes from the bone that we have here. We have a bone that is called the frontal bone. You will see that if you recall anatomy, one of the way how anatomists studied the body at the beginning when they tried to learn the structures of the body was using an approach that's called regional anatomy. So you will see, what I'm trying to say is that you will see that there's many regions in the body which the names of the regions are related with the structures that are there. Like buccal region is called the buccal region because in that area there is a muscle that is called the buccinator muscle. Orbital region, the orbit in the bone, you will see later in the class the space where the eyeballs are located is called the orbit. So that's why this area is called the orbital region. Nasal region is the area of the nose, right? Otic is the area of the ears. Oral region, mental region is the portion of the chin. So it's crucial for your exams that you know more than the common name like chin, that you know or you get familiar with the anatomical term for each region. All right, so we just review the cephalic region and the cranial facial region and all the subdivision. We said that the cervical region is just cervical. Now let's review all the regions of the trunk, right? So we have 6. The trunk can be divided in thoracic region, here in red, in blue, abdominal region. Below the abdomen, we have the pelvic region, and the area of the groin is the inguinal region. And then importantly, the pubic region is the area where the genitalia is located. That is the pubic region. And finally, we have the back, which is called the dorsal region. The thoracic region can be subdivided in sternal, mammary, and axillary region, which you can see here. Remember that axillary region is also called the armpit. That's the armpit is the common name. It's called the axillary region because you will see that we have lymph nodes that belongs to the lymphatic system. All the lymph nodes that are located in the armpit are called the axillary lymph nodes. So that's why this region is called the axillary region. Also, we have an artery that pass through this region, and the name of that artery, you guess right, is the axillary artery. So axillary region, armpit, sternal region in the center. Recall that we have a bone, it's called the sternum, and the sternal region is called that way because the bone, the sternum. The mammary region is the biggest region here in the thoracic. Sometimes this is also called the pectoral region, but essentially it's the region where we have the mammary glands, which of course are more prominent in females than males. Now the rest are the ones that we just discussed: abdominal, pelvic, pubic, inguinal region. Here in the dorsal region, we can name this area where all the vertebra is located. That is the vertebral region. We have the lumbar region here in the lower back. Now we'll have also, you will see that the abdominal regions in front and the anterior view. This is posterior view, but in the anterior view, we have the abdomen at this level. And you will see that there's a division of the abdomen in which we call the lumbar regions. So you will see that there's 9 regions of that we can divide the abdomen in 9 regions, and one of those 2 out of the 9, they're called the lumbars. So we're going to see that later. And the sacral region refers to the area where the sacrum is located. We have a bone here. It's called the sacrum bone. So the region is sacral region. All right, let's finish this part of the regions with the upper limb and lower limb. Now, what you need to look here is that there are regions that they're called the same way in the anterior and posterior view. Like the brachial region, which is the arm, is called the brachial region anteriorly and the brachial region posteriorly. Now, the tip of the shoulder, or the highest point of the shoulder, is called the acromial region. Now, in the second part of anatomy and physiology lab, when we learn the scapula and all the bone markings of the scapula, you will learn that in the scapula we have the acromion process, which is located in that area, and that's why that area is called the acromial region, because it's the place where the acromion process of the scapula is located. Now we have here the arm is the brachial region, the forearm is the antebrachial region, in front and back. Now, between the brachial and the antebrachial region, we have a name for this region in front is called the antecubital region. So brachial, antebrachial, antecubital. Now, be careful with this part because the back of this region is not called the antecubital region, but it's called the olecranial region. Now, olecranial regions refers to the part of the bone that is here. So we have a bone in the forearm. This big bone here is called the ulna, and ole means elbow in Latin. Cranial essentially means, you can translate that as a head. So the head of the elbow, the olecranial region, is the head of the elbow. Which bone or which head of the elbow? The ulna bone. So the head of the ulna bone or the elbow is located here in the back. That is the olecranial region. Now, regions of the wrist is called the carpal region. We have the carpal bones located in the wrist, and if this word ring a bell to you, is because there's a famous syndrome that's called carpal tunnel syndrome. Then many people suffer, especially when they work doing repetitive motion of the wrist. People who for example are work in the barber shop, or people who spend a lot of time typing in the computer, they might have inflammation of the tendon with compression of the nerve, of the median nerve that pass here through this carpal region. In the palm of the hand, the palmar region, but more important, the thumb. In anatomy, this is called the pollex. And then the rest of the digits, digital region or phalangeal region. Let's finish this lower limb now. Here we have the largest bone. It's called the femur. So the region of the thigh is called the femoral region. Now we have the femur bone, we have the femoral artery, we have the femoral nerve. So everything here is kind of related. The name is going to remain pretty similar. Femoral region, femoral nerve, femoral artery, femoral vein, femur bone. I mean, this is called the thigh, and this is called the leg. So the leg, the name of the region changed interiorly. This is known as the crural region, but in the back it's called the sural region. So crural regions in front, sural regions in the back. Now, between the crural and the femoral region, we have here the patellar region. We have a bone here, which is the knee, the bone of the knee. And this is called the patella bone. So this is called the patellar region between the femoral and the crural in the anterior part of the body. Now, behind the knee, behind the patella region, the name of the region change. So in this area now the region is called popliteal region. So popliteal region is the region of the back of the knee, and as you can imagine, something must be called popliteal. In this case, we have an artery that when it passes through this area is called the popliteal artery. Going down in here in the ankle, tarsal region. So if you see tarsal and the ankle and carpal in the wrist. So be careful with that. Carpal here in the wrist, tarsal here in the ankle. Pollex, thumb, hallux, and the big toe. So make sure you know pollex in the thumb, hallux, the big toe. And then the other ones, they kind of remain the same. Now the palmar regions here in the hand and the plantar region here in the feet. Now we have here in the heel the calcaneal region. You guessed right, there is a bone that's called the calcaneal bone, so calcaneal region. Now we're going to cover the regions of the abdomen here separately because we can divide it in, we have two systems how we can divide the regions of the abdomen. One is using a quadrant, so 4 quadrants. Quadrants means 4, right? So this is the quadrant, or using the 9 abdominal regions. So let's check that next. This is important to know because in the practice, you will see that if you work in the hospital or if you work in just a doctor's office, when you read medical histories or when you see the patient chart, you will see that when we describe pain or when we try to describe an injury or a wound or something in the abdomen, we can use these or these. So you must be familiar with both ways. So let's review the simple, which will be this one. Now, importantly here, more than just know the location, is also try to remember which organs are related with which regions of the abdomen. So we have in the quadrants, remember quadrants like a quarter, it means 1 out of, so it means quad means 4. So the quadrants is pretty easy, pretty straightforward. Right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. This is the easiest to remember, right? The next one, the abdominal pelvic regions. It's called abdominal pelvic because it's going to cover not just the abdomen, but also in the lower levels, the pelvic. What you need to know here is because there are 9, you need to know that all these 3 portions here are the superior portions. All the ones that are here are the inferior. And here, between those, that will be the middle. So if I try to ask you about one of those regions, if I said the superior part of the abdomen, superior right, you must know that I'm talking about this portion. If I said the most inferior and left region of the body, inferior is this and left is this one. So be careful with this when we use superior, middle, or inferior in the abdomen, especially if we try to ask you something about the 9 abdominal pelvic regions. So let's review those regions. Let's begin with the superior part. So in the middle, we have the epigastric region. Now it's called the epigastric region. If you look this organ here, this is like a cream color, I think. So this is the stomach. Most of the time when we talk about the stomach, we refer the stomach as a gastric. So epigastric, like gastric acid, like gastritis, inflammation of the stomach. So epigastric, epi means besides. So epigastric, besides or on top of. All right, so this area, which is besides on top of the gastric, on top of the stomach, epigastric region, right? Then we have the left and right hypochondriac region. Now, why this region is called hypochondriac region? So let's break down this word. Hypo means below. So hyper means on top or above. Hypo means below. Chondriac means cartilage. We will see later in your lecture when we review joints that cartilage, chondrocytes are the cells that make cartilage. So hypochondriac, chondriac means cartilage, and if you look the rib cage, we have the ribs here, but then, and this is the sternum, and those are the ribs. So between the ribs and the sternum, this is cartilage. So as you can imagine, all this here that I'm drawing is no bone, but is hyaline cartilage. So hypochondriac region is the part of the abdomen that is below this cartilage, hypochondriac region. Right, the area where the belly button will be located. Remember that the belly button is the scar from in babies, for example, is where the umbilical cord is attached to the placenta. So that area where the umbilical cord is located is called the umbilical region. Make sure that you don't confuse epigastric region and then think like, okay, below the epigastric, it must be the hypogastric, because here really what it is the umbilical region. Below the umbilical region, we have the hypogastric. So be careful with that one, because I just told you that hypo means below, like hypochondriac, but here's kind of the exception of this. Hypogastric region means below the stomach. It should say hypoumbilical region. It will make more sense, but it is what it is. So hypogastric region is below the umbilical region. The other ones, let's review. These ones I mentioned when we review the back. Remember that we have in the back the vertebra. So we have all here, we have bones, and we have the cervical vertebra, the thoracic vertebra, and then we have the lumbar vertebra, which they're in the back, of course. But this area in the back is called the lumbar region. So this left lumbar and right lumbar. This is in the middle portion of the abdomen. So superior we have hypochondriac, in the middle we have lumbar, and then let's look at the inferior. Iliac region, so right iliac region, left iliac region. The name of this is because this bone that we have here is called the ilium. Therefore, the region is called the iliac region because the bone is the ilium bone. Other than be able to recognize the regions of the body just using images, or if I told you what is the inferior and right regions of the abdomen, you should be able to tell me that is the iliac region. So also it's important you know which organs are located in each region, right? Here we're going to use the quadrants. So let's begin with the right upper quadrant. Number one will be the liver. So all this organ here is the liver. Number two, in green, the gallbladder. Number three, down here in the right lower quadrant, we have the cecum. And four, we barely can see it, but we have a part of the cecum, which is called the appendix. But other importance here in the left upper quadrant region, number five, the stomach. The stomach, if we remove the liver, will look like this. So this is the stomach. Number six, and this is important. Remember that to learn anatomy, you need to try to learn location in shape instead of color and textures. So look at here. Number 6 is the spleen. We only have one spleen. We only have one liver. The liver is in the right part of your body. The spleen is in the left part of your body. And then finally, in the left lower quadrant, we have the sigmoid colon. It's called sigmoid colon because this part of the colon has like an S shape. In this particular model, in this picture, we cannot appreciate that, but I'll show you this later when we review digestive system. You will see why the sigmoid colon has kind of this S shape. All right, now we're going to learn all the organs, all the parts and the structures of each organ systems. This is what you need to know for your lab exam in terms of body organization. This is going to cover a lot. All right, now let's review the first organ system. This is going to be the skeletal system. And this is by far the one that you will need to learn and memorize more parts because we learn most of the bones in your body. Now, for this exam number 1, you just need to know the name of the bone. We will not ask you about any details about each individual bones. Or bone markings. You just need to know the bones. So I would suggest, because there are a lot of bones, that you start with the upper and lower extremities. Make sure that you know that in the forearm or the antebrachial region and in the leg or sural region or crural, depending how you're looking at it, we have two bones. So in the forearm and the leg, we have two bones. What you need to know is, other than just the name of the bones, also which bone is medial and which bone is lateral. We've been talking about this, so this is kind of a recap. All right, let's begin with the upper extremity, and let's start with the humerus. All right, the humerus is the bone that connects the upper limb with the axial skeleton. Right. Always the humerus is going to be proximal because it's the one that is actually articulating with the trunk. Now, if you put attention here, the humerus articulates with the bone that is here in green. If you look, the posterior view is easier to identify. This is the scapula. All right. So we have the humerus, we have the scapula. When we review the regions of the body, we mentioned that the tip of the shoulder was called the acromial region. And this is just a bonus, but this portion of the scapula is called the acromion process. And that's why this region is called the acromial region. Now, in the forearm, we have two bones, the ulna and the radius. Now, the medial bone is the ulna. Right? The ulna is the bone that is closer to the midline. The radius is the lateral bone of the forearm. Next, let's look at the femur. The femur is the largest bone in the body, and it connects the lower extremity with the axial skeleton here at the level of the coxal bone. These coxal bones, this one and this one, sometimes are called the hip or the coxal bone or the pelvic girdle. The pelvic girdle and the pectoral girdle and the bones that connect the upper extremity with the axial skeleton, coxal or pelvic girdle, the bones that connect the lower limb with the axial skeleton. So the femur, okay. Then we have two bones. The tibia is the medial bone of the leg, is the largest here. And then we have one that is a little bit more thin and long, is the fibula. Right? So the tibia is the largest of those two. The fibula is the lateral bone of the leg. Between the femur and the tibia, we have the knee, and that bone is called the patella. right? So femur, patella, tibia, fibula, humerus, ulna, and radius. Now, let's look at the bones in the wrist and the ankle. This group of bones are called the carpal bones. And this group of bones in the ankle are called the tarsal bones. The regions are the same name, tarsal region, carpal region, respectively. Okay, those are the bones of the extremities. Now let's finish this, or let's cover these, the bones that connect the upper limbs with the trunk in the upper extremity and the lower extremities. So here in the top we have two bones. One already mentioned, the scapula, and the second one is the clavicle. Both bones together, they're known as the pectoral girdle. Pectoral girdle. The pectoral girdle connects the upper extremity with the trunk. The coxal bone. All right, the coxal bone is this bone. Now it looks like a big, but it really is three bones in one. Those three bones are so close each other that they fused. In an adult, you will not be able to see sutures, or most of the time you will not be able to see where is each bone. But this is one of the bones that is the more challenging for students, because you will be required to know which of these coxal bones is the ilium, which is the ischium, and which is the pubis bone. So we're gonna invest a little bit of time later, and I'll give you the tips to try to keep these straight, to know which bone is the ilium, the ischium, and the pubis. For now, just know that this is the coxal bone, or the hip bones. All right, now let's review the axial skeleton. That means all the bones here in the head, all the vertebra, the sacrum, right, and the rib cage. So let's just start with the small one. We have here, not the small one, the more inferior. This has like a triangle shape, like a upside down triangle. This is called the sacrum bone. We don't have here a lot, we cannot see, we don't have an arrow pointing this part, but we have a small little bone here, which we normally call the tailbone. This is the coccyx bone. So coccyx, sacrum, right? Then we have the vertebral column. All the vertebra. The vertebral column is made by, depending, the name of the vertebra will change according to the region. But for now, you just need to know that the ones that we have here in the neck, they're called the cervical vertebra. The ones that we have here in the thoracic cavity, or I'm sorry, in the thoracic region, those are the thoracic vertebra. And then the last 5 vertebrae here are called the lumbar vertebra. Right? We have 7 cervicals. So C for cervical, 7. We have 12 thoracics. I'm going to put a T for thoracic. We have 12. And we have 5 lumbars. I'm going to put a L for 5. So when we use the mnemonic that we use to remember how many cervical vertebrae, how many thoracic, how many lumbars, is try to remember the times of the day you eat. So we eat breakfast at 7 a.m., we eat lunch at 12, and some of you might eat dinner at 5 p.m. So 7, 12, 5, those are those are the amount of vertebrae that we have per region. All right, if we look in the interior view, going back here, we have the rib cage. All these will be the rib cage. And the rib cage, we have a bone in the center. All right, this bone, as the name of the region, external region, this is the sternum. And we have the ribs. Now, how many ribs do we have? So the amount of ribs equals the amount of thoracic vertebra. So I just told you that we have 12 thoracics. Well, we have also 12 ribs. Each rib will articulate with each thoracic vertebra. So we have 12 ribs in each side, 12 in the right side, 12 in the left. With the bones of the cranial portion and the facial, we're going to review that in just in a minute. This is another view. This is another model. Now this looks more like the real bones. And we have here a few bones in the head that you need to know. The lower jaw is called the mandible, and the upper jaw is called the maxilla. All right, so maxilla is the upper jaw, mandible is the lower jaw. The bone with the frontal bone, or the more anterior bone in the forehead, is called the frontal bone. Right? The most posterior bone of the head, the one that is way back here, is called the occipital bone. Now, what you need to put attention and try to remember also is that the cervical vertebrae that I told you that we have 7, the first vertebra, which is here, is the one that articulates directly with the occipital bone. All right. Now, this first vertebra is called the atlas. For now, you don't need to memorize this. You're going to need that for the lab number 2. For now, just remember that the occipital bone is the bone of the skulls that articulate with the vertebra. Occipital bone. And then we have 2 bones here in each side. They're called each side and superior. We have the parietal bones. So this will be the left parietal bone, and this will be the right parietal bone. What else? I think the others we already mentioned. I'm just going to add here in the coxal bone, we can see in the anterior view the ilium and the pubis. Remember that the coxal bone is made by 3 bones. The first one and more superior and large is the ilium. Make sure that when you write in this in the exam, you write it correct. Ilium. And I'm mentioning that because in the digestive system, especially for AP2, there's a portion of the small intestine that is called the ileum. Right? So the only difference here is 1 letter. Right? So make sure that in the exam you put ilium and you put the I here. All right? Ilium is the name of the first and more large coxal bone. You can see the ilium in both views. You can see it in the anterior view, will be all this, and you can see it in the posterior view, will be this. All right, so that is the ilium. Now the pubis bone, you can see it in both views, but you can see the majority of the bone in the anterior view. This is called the pubis, and we have 2. Pubis bone. Now you might see just a little portion, this little triangle that I'm drawing here. This little portion is part of the 3rd coxal bone, which is called the ischium or ischium. The ischium bone is more posterior, so you will find this bone, or it's going to be easy for you to identify if you look this bone from the posterior view. Now, the part that I mentioned that students struggle with these bones is not too much to know what's the ilium, because the ilium is easy, is the more superior and the more large. But the tricky part here is sometimes when you have an exam, sometimes this is what causes problems, to know which is pubis, which is ischium. Pubis always is the bone that is in front. Ischium is the bone that is in the back. And that sounds obvious, but when you have a lateral view of this coxal bone, sometimes it can be tricky. So we're going to see, we're going to spend a little bit more time learning this coxal bone in the next few slides. Okay, so I have here a posterior view. All right, so we're looking at the back. This bone that looks like a triangle, this should be a landmark for you. This bone here is very unique, and it's called the sacrum. All right, the coxal bone, you don't, I mean uh, the coccygeal bone, you don't need to remember this for now. All right, let's just go back to the coxal bone. So we have the three portions of the coxal bone. You can see here in color in green, that represent the ilium. Notice that this portion with the little holes, if you translate that to here, is this bone. So remember the secret. We do not memorize colors or textures. We memorize basic shapes. So that is the sacrum. This bone here will be this one here. Okay, look at the holes in the coxal bone. We have a hole here and we have another here. Those are these. Now you can see those are ligaments that we don't have here, but if we want to draw those ligaments will be somewhere around here, of course. All right, but you don't have to worry about the ligaments. Now look at the ischium in the posterior view. The ischium is a bone that is more posterior, and you can still see a little bit of the pubis bone in the posterior view. But again, the part that really makes the students miss questions about this is when we show the lateral view of the coxal bone, which is what I'm going to show you next. Okay, so now here we have a lateral view of the coxal bone, and I color this portion of the bone so you can see which color represent each part of the bone. So in pink we have the ilium, we have the pubis, and we have the ischium. Now this is the anterior part, so this is the front, this is the posterior part. In anatomy, when we look at structures that are small, most of the time we cannot show you the entire human body. We might show you just parts, and you have to have imagination to know exactly which part we're showing to you, right? What part you're looking at here. So just to practice, I'm going to try to draw what will be if I add a skin. This portion here will be the gluteus. This will be kind of the part of the thigh, something like this. And then here we're going to have the beginning of the abdomen. So if you want to draw, like for example here, the belly button will be somewhere right around here. So you hopefully you can appreciate that this thing here will be the thigh, this will be the gluteus, and this will be the back, okay, the lower back right there, and then the front, right? Now if you are able to recognize that this is the ilium bone, and the more prominent portion of the ilium bone is kind of facing to the posterior part, it's kind of facing backwards, it's kind of facing towards the back. So you can imagine that portion here might be, if you just look the bone, think about this is the gluteus, right? If you know that, you will know that this is the posterior part, and you will know that therefore the anterior part will be here, right? After that, once you are able to identify what is anterior and posterior, it's going to be easy for you to remember that the ischium is always posterior and the pubis is always anterior. Now with the dot line, I make this the place where the femur articulate with the coxal bone. Notice that there is a hole here. There's the articulation socket for the femur, and there's a hole here, so don't confuse that with the articulation point. This space here, this foramen has a name, but you don't have to worry about that right now. Look at the sacrum bone, will be here. So just by looking at this picture, pause the video and ask yourself, which coxal bone is this? Is this the right coxal bone, or is this the left coxal bone? What do you think? All right, if you get right, that is correct. This is the right coxal bone. This is another view. This is now an anterior view. You can see here the patella, the tibia, which is the largest bone here in the leg. We have the fibula, which is a lateral bone. So this is the fibula. This will be the tibia, right? Patella. And then the femur, the sacrum in the anterior view, right? This will be the lumbar vertebra, the ilium, which essentially covers the majority of this. And then we have the pubis bone and the ischium down here, just a little portion. Okay, let's review the other organ systems. The nervous system is going to be very easy. You just need to remember 3 portions of the nervous system. The brain, which will be this in red. The spinal cord, which is the center, okay, and which is blue here. And the nerves, all the peripheral nerves, and also includes the cranial nerves. Everything that, if it ends with the name nerves, that is peripheral nervous system, that is the portion of the nervous system. So just 3 structures: the brain, spinal cord, nerves. Now we have the endocrine system. These systems, together with the nervous systems, are the systems that are in charge to regulate everything in your body. They're the organ system that maintain the homeostasis. They're the organ system that keeps everything in balance. Both organ systems work together. The nervous system acts more faster than the endocrine system, but the endocrine system work in the long term, and if anything needs to be adjusted in your body, the endocrine system is the organ system that will regulate that through hormones. So the organs you need to know about the endocrine systems are not all of them, but the majority of the organs, you can see it here. All right, so in the head, for now, you just need to know the pituitary gland. Pituitary gland is a gland that is located in the brain. We're going to see pictures of that in a minute. In the neck, we have 2 glands, but you just need to remember the thyroid gland. There's another gland that is behind the thyroid. It's called the parathyroid gland. For now, you just know that the thyroid gland is the gland that is in the neck. In the abdomen, we have several, but for now, you just know the pancreas. This organ, the pancreas, is an organ that it has double function. So it belongs to the endocrine system because it's able to release hormones that are going to regulate, for example, your sugar levels or your glucose levels in your blood. But also this organ is able to release pancreatic juice, which is a crucial component of the digestive system. So the pancreas belongs, a portion of the pancreas belongs to the endocrine system, and there's a portion of the pancreas that do digestive function. So it belongs to both. Adrenal glands, those are pure endocrine glands. Both glands are located on top of the kidneys. So your goal is, in order to identify adrenal glands, is to be able to identify the kidneys. The kidneys are those organs that look like beans, and we practiced this at the beginning of this video with the I show you different pictures of the kidneys, and I told you that you need to memorize the basic shape of a kidney that will be something like this. All right, those are the kidneys, and on top of the kidneys we have the adrenal glands. It has this shape, kind of triangle or pyramid shape. The vast majority of the glands, when we see it on the models, they are going to look like fat tissue. They're going to look like yellow, and they will have these kind of irregular borders. They're going to look like fatty tissue. All right, just keep that in mind. And then in the female and the male, we have the gonads, we have the testes in the male, and the ovaries in the female. We use testes when we talk about both, so when it's plural. If we just mention one, or if we just referring to a single one, it's called testes. All right, so testes for a single, testes for plural. All right, let's review the pituitary gland. Now, again, you need to find these. When you see the pictures, you need to ask yourself, what view is this, and which, if the brain has been cut or an organ has been cut, you have to know. Try to ask yourself which cross section is that. So, for example, we have this organ here. This is the brain. Now, I'm going to tell you that this brain has not been dissected, so it's not been cut, right? Which view do you think is this of the brain? Do you think this is anterior, this is posterior, lateral, is this superior, or is this inferior? I'm going to give you a few seconds, so you tell me if it's anterior, posterior, lateral, superior, inferior. What do you think? Pause the video and just try to guess to the answer. Okay, if you say inferior, that is correct, right? This is an inferior view. Let's look at this picture just to emphasize that. So we have this structure. I told you it should be a landmark. This is the cerebellum. That structure is this one here in brown, and that structure is this one here in brown as well. So the way how this image that we have here is like looking at the brain from this view. So we're looking at, imagine that this is your eyeball here, and you're looking at the brain in this direction. So when you look the brain there, you're going to see this gland that is not inside of the brain, but it's kind of very close. That is the pituitary gland. Now, this view is a lateral view, and the brain has been cut. So this is a sagittal cross section. So sagittal cross section. And here we can see the pituitary gland hanging there. So sometimes it's hard. I would suggest that you just keep in mind that the pituitary gland is not within the brain. So it's not going to be this. It's not going to be this. It's not going to be this. It's going to look like a circle. It's going to look like a ball, but it's going to be a little bit outside of the brain. That is the pituitary gland. Okay. The next one is going to be in the neck, and we have here the thyroid gland. Look at the thyroid gland, how it looks. It looks like yellow, and it looks like a fatty tissue. This is how it looks in the models that we have. So all these yellow part is the thyroid gland. Now, you will see that we are reviewing the endocrine system, but many of the systems are related each other with other systems. So, for example, we have here in the structures called the larynx. Below here we have the trachea. Those organs, or those are part of the respiratory system. Now, this is something that the students get wrong in the exams pretty often. Most of the time, students, when we show pictures of the neck and we point here, they say, oh, it's in the neck, the thyroid gland. Or vice versa. We point the thyroid gland and say, oh, that's the neck, that must be the larynx, or that must be the trachea. So be careful with those two. The trachea always is going to look in the larynx. Those are cartilage. So most of the time, they're going to be either gray or blue. Most of the time we use blue to represent cartilage. We use red to represent arteries. We use And this is going to be a light blue, okay? Sometimes we use dark blue to represent veins, but keep in mind that the thyroid gland always is going to look like fatty tissue and yellow, all right? The trachea and the larynx, I'm going to go through that when we review the respiratory system in a minute. Right, let's look at the organs in the abdomen that belongs to the endocrine system. Now, here is an example. So, in order to be able to visualize those glands, we need to remove some organs from our way, because otherwise we will not be able to see them. They're going to be covering. So we remove the liver. All right, the liver will be somewhere around here, and remember, it will look like this. The gallbladder will be just a little ball here. And of course, we remove the stomach. I put this kind of cartoon here to show you where the stomach will be. So once you remove the liver and once you remove the stomach, then you can see portions of the adrenal glands and you can see the pancreas. So the pancreas is this large gland that is in the center of the stomach, or is in the center of the abdomen. That is the pancreas. You can see the pancreas represented here. We only have one pancreas. We have two adrenal glands. Look at the adrenal glands. And again, if you look, all of the three, they look yellow. They look like fatty tissue. So I'm going to show you next another picture so you can be able to see the kidneys and the total organs. So in the next picture, I'm going to show you, I'm going to remove essentially all the small intestine, large intestine, all the pancreas and all that, and you're going to see just the kidneys and the adrenal gland. Okay, this is a different picture from a different model, but the thing is, you can see here, these will be the kidney. Which kidney, right or left? Okay, if you say right, that is correct. And then we have here the other kidney, that will be the left kidney. Now, the fatty tissue that is on top of the kidney, that is the adrenal glands. Right adrenal gland, left adrenal gland. Okay, let's look at these models. So, do you think, which cross section do you think is this one? Well, I write it down here. This is a sagittal cross section. Of course, this is a lateral view. So this is the male and that is the female. Now, when you have a sagittal cross section, many times you start seeing things that look weird, like this. What is that? Right? So again, most of the time you will see bones or organs that is the way how they look when they cut. If you have a hollow organ that is not a solid organ, you will have like a hole here, like a space, like a chamber. So that, for example, is part of the colon. It's part of the sigmoid colon that has been cut in half. Look at the sacrum bone. We just learned the sacrum bone. And look how the sacrum bone looks like when you look that bone from the lateral view and when you cut it in half. This is the sacrum bone, right? Now, here you need to know in males, the organ or the gland of the endocrine system are the testes. Notice testes because we can see just one. And in the female, the ovaries. What you need to do, especially with the ovaries, if you just look for that yellow fatty tissue, that's going to be the gland. And here in the male, this is the testis or testicle. Cardiovascular system and lymphatic are going to be very easy because you don't need to memorize many structures. With the cardiovascular system, you just need to be able to identify the heart. The heart is in the center of the thoracic cavity, right? So that is the heart. And then two major blood vessels, which are the aorta and the vena cava. Now, at this point, if it's blue, it's the vena cava. If it's red, it's aorta, period. The aorta and the vena cava, those are large blood vessels that you can see them in the thoracic, but also in the abdomen or abdominal cavity. In the thoracic cavity and abdominal cavity, you can see here this portion of the aorta. This blood vessel comes from the heart, and then kind of goes around and behind the heart and then descend all the way to the abdomen. All this portion here is the aorta. All this blue here is the vena cava. If you are able to, if you remember the regions of the body, the name of the lymph nodes of the lymphatic system are going to be very easy. Remember, what was the name of the region of the armpit? The axillary regions. So the name of all these lymph nodes, all these kind of yellowish lymph nodes are the axillary lymph nodes. What was the name of the groin? That was the inguinal region. So the lymph nodes are called inguinal lymph nodes. The appendix, which is part of the cecum, we're going to see that in the digestive system in just in a minute. And the spleen, this is the kind of the organ you need to remember there. So the spleen is most of the time, remember, location and basic shape. That's what you need to remember for anatomy. So location most of the time is kind of behind, and you can see always a little portion of the spleen, right? If you have the stomach, you will see just this portion. If you do not have the stomach, of course, you're going to see the entire organ here. So in this picture here, this portion here is the stomach. So that little portion, you can barely see it here. That is the spleen. Which organ is going to be here? Well, this organ here is the liver, and this green here is the gallbladder. Other things is, most of the time, if you have a cartoon of the lymphatic system, the lymphatic system is going to look green. All right, you can see here the spleen. We only have one spleen, and it's in the left side of the body. But you can see that lymphatic system, we represent that most of the time with green, and all these green dots represent lymphatic nodes or lymph nodes, and the lymph nodes will have the name of the regions. The ones are in the neck, for example, cervical lymph nodes, armpit, axillary lymph nodes, and the groins, inguinal lymph nodes. Behind the knee, we have some lymph nodes that are called the popliteal lymph nodes. I mentioned a few minutes ago that the pancreas belongs to two different systems, one portion digestive and the other portion endocrine system. The pharynx is kind of the same. So the pharynx is one portion here, is a hollow organ, it's like a tube that allows air coming from your nose and going through your lungs. So allows um, the transport of air, but also the pharynx is this space when you eat, and the food that gets in your mouth pass through the pharynx to go to the esophagus, which is a part of the digestive system. So the pharynx, it allows movement of air for the respiratory and food from the digestive system. The pharynx, we know this as the throat. That's the common name, is this space here. We're going to see pictures of the pharynx in more detail. Below the pharynx and more anteriorly, we have the larynx, right? The larynx is important because in the larynx, we have the vocal cords, and the vocal cords are the parts of the respiratory system that every time we speak, we talk, that's what generates the sounds when air passes through that, and that's how we are able to make sounds or noises or speak. Below the larynx, we have the trachea, right? The trachea always is going to look, and again, larynx and trachea, those are cartilage. They're going to be blue, and they're going to be like light blue. The trachea is very unique. Always keep looking these ring-like shapes. So the trachea will look not just like a tube, but it will have all these kind of rings around. So whenever you see these kind of ringing or rings around a tube and it's blue, that is the trachea. After that, the trachea will divide in two primary or main bronchus, right? Right main bronchus, left main bronchus. And then later, those bronchus are going to become smaller and smaller and smaller. And then we have two lungs. Those are the lungs, each in each side. Now, if we want to draw some of the things that we just learned, where will be the heart located? Well, the heart is going to be here. All right, we have here the diaphragm. So that is the diaphragm muscle. That's what divides the thoracic cavity and the abdominal cavity. If we want to draw the thyroid gland, which is part of the endocrine system, remember the thyroid gland is right below the larynx, so it will be somewhere around here. Of course, in this model, we don't see it because we want to see just the respiratory, but if we draw the thyroid, we are going to draw the thyroid somewhere around there, and we're going to draw the heart somewhere around here. This is a closer view of the pharynx. You can see here in this model, which view do you think is this? Anterior, posterior, superior? Well, this is a lateral view, right? Which cross section we use to show you the pharynx here? Transverse, coronal, sagittal. So it's a sagittal cross section. It's a lateral view with a sagittal cross section, which, remember, the sagittal cross section will divide the body in right and left. Which part of the body is this? The right side of the body or the left? If you say right side, that is correct. This is the right side of the body. This is the more medial aspect of that, or internal aspect of that right side. Okay, now I was saying that the pharynx is essentially a tube that communicates the nose, the mouth, either with the larynx or the esophagus. So the larynx belongs to the respiratory system, but also to the digestive system, because it's essentially a passageway for where the air or the food pass through any of those two structures. Now look at this picture here. All right, what I want to show you here in purple, we have the pharynx. All right, all this is going to be the pharynx. The pharynx can be divided in three portions: nasopharynx, oropharynx, laryngopharynx. You don't need to memorize those, but just look at the picture here that when you swallow food, this is the tongue. When you swallow food, that food is going to go from your mouth all the way to the throat. Pharynx, remember the common name for pharynx is the throat, and then the food will go down to the esophagus. So this esophagus finally is going to reach your stomach. The stomach will be here. All right, this is the stomach. Now the larynx is the portion of the respiratory system. When you breathe air, when you inhale, air goes through the pharynx and then turn anteriorly to the larynx and then goes down to the trachea. Remember, from the trachea, in some point, the trachea is going to divide in two main bronchus, and then we're going to have the lungs somewhere here. But the bottom line that you need to remember is that the larynx and the trachea, they're more superficial than the esophagus. The esophagus is more deep. It's a deepest structure if we compare that against the larynx, for example. This is another view, there's another model. You can see here the larynx always is going to look blue because it's cartilage. All this is the larynx. Notice this gland here. Which gland do you think is that, since we just learned endocrine system? If you say the thyroid gland, that is right. The thyroid gland is this gland here. The trachea, keep looking for those ring-like shapes. That is the trachea. And then we cannot see the main bronchus because the lungs and the heart cover that, right? But if you look in this other picture where we remove and cut part of that, you can see the bronchi. Bronchi, when you see both, when it's plural, bronchus when it's singular. So bronchus if it's just 1, bronchi if it's 2. Notice that we remove here the heart. Once you remove the heart, you can see behind the heart what structures do we have. So this muscle, this tube, is the esophagus. I just told you a few minutes ago that the esophagus runs posteriorly or is deeper than the trachea. Look at the trachea is going more superficial. If you remove the trachea, you're going to be able to see the esophagus running all the way to the pharynx. And then we have here the aorta. If it's blue, it's a vein. If it's red, it's an artery. And the only two blood vessels you need to know is the aorta and the vena cava at this point. Now let's review the digestive system. Digestive system can be divided in two big groups: the alimentary canal organs and the accessory organs. So the alimentary canal organs are all the organs of the digestive system that essentially are hollow organs. They're like a tube. They have a space and where the food is going to pass. The accessory organs are organs that they release chemicals in order to achieve digestion. Some of those accessory organs are the liver, for example, the gallbladder, the pancreas, which is located here. Those are organs that are going to release chemicals, substances, enzymes that are going to break down the food in order to be digested and be absorbed. Now, all the rest, they're hollow organs, they're part of the alimentary canal. So we can see here again the pharynx, okay? Below the pharynx and posteriorly, we have the esophagus. We just learned that this is the larynx. If we want to draw what is next, it's going to be the trachea. It's going to go this way. And then if we want to keep drawing, the trachea will divide in bronchi, and then we're going to have the lungs, all right? But keep in mind, trachea in front, esophagus a little bit deep. After that, between the pharynx, we have, going down, we have the esophagus and then the stomach. The stomach is this organ here. Right? After that, we have the small intestine. This tube here is, and all these is the small intestine. Then we have the large intestine. Now, the names of small and large, it doesn't refer to the length, because the small intestine is actually way longer than the large intestine. It's just that the large intestine is just bigger in terms of diameter. Now, the large intestine, we have different portions, which I'm going to show you in a minute. But for now, you need to know the cecum. The cecum is important because this is the portion of the large intestine or the colon, that communicates the last portion of the small intestine. So the small intestine will be here, and then the small intestine attaches to the large intestine in this area, which is called the cecum. Here in the cecum, we have then this kind of projection here, this kind of worm-looking structure, that is the appendix. And if you heard the word appendicitis, this is a condition, this is a problem when the appendix gets swallowed, and when there's inflammation or infection of the appendix. And if you heard this, appendicitis is surgery. So the only way that we fix appendicitis is removing the appendix. Now, after that, we have the other parts of the colon. So this will be the ascending colon, transverse colon, descending colon. And then at some point, we're going to see the sigmoid colon, the rectum, and and finally we have the anus. So we have the rectum and the anus. Okay, let's review the liver. So the liver again is, we have just one liver and it's in the right side of the heart. All this is the liver. Right below the liver, we have the gallbladder. Right? Besides the liver, we have the stomach. In this view, we cannot see it, but if we rotate this model a little bit, we're going to see a little portion of the spleen. Remember, the spleen is besides the stomach. We only have one spleen, and the spleen is in the left side of the body. Then we have small intestines, large intestines. You can see the esophagus in the thoracic cavity. These, hopefully you can recognize that this is the liver here. So this is the thoracic cavity. This muscle here will be the diaphragm muscle, and then these are going to be the lungs. Okay, so we have another lungs here. Notice this ring-looking appearance structure, that is the trachea, but in this case, this is the bronchi. So this is the primary bronchus, the left, and the primary bronchus, the right. The trachea will go up here. Now, behind the trachea, we have esophagus, and then in red, we have the aorta. Look at this picture. We remove several organs. We don't have the small intestines in this one. We have the colon, we have the cecum here, and then all these represent the colon. Look at the pancreas. Pancreas always is related with this organ that we have here, that is the spleen. All right, we remove the stomach, that is the spleen. If you look other gland close to the pancreas, that must be the adrenal gland. So this little portion here, this fatty tissue looking, this gland that is here is the adrenal gland. And which adrenal gland? That is the left adrenal gland. Below the adrenal gland, we have the kidney. So this brown portion here is part of the left kidney. Of course, we cannot see the entire organ. You can see just a little portion because it's been covered by the pancreas. But keep in mind that that must be the left kidney. The sigmoid colon is called the sigmoid colon because it has kind of like a S shape. Kind of make this shape here. Hopefully you're going to be able to see these better here. That is the sigmoid colon, this last portion before you get to the rectum and the anus. Now let's finish this class with the last two organ systems, urinary and reproductive. The urinary system is formed by a few organs, the kidneys. So we have left kidney and we have the right. You might ask yourself why this kidney looks weird. It's just because it's been cut. We make here a coronal cross section, and now you're seeing this posterior half of the kidney. But that was a coronal cross section. Below the kidneys, we have the bladder. Right? So between the kidneys and the bladder, we have two, like a tubes, if you will, that communicate the kidneys and the bladder. The urine that is produced by the kidneys moves through the kidneys, move from the kidneys through these tubes that are called ureters. So we have two urinary ureters, which are those here. And then when you have the urine full, the bladder full of urine, we're able to, the process of voiding or micturition or urination is through the urethra. Now, we cannot see the urethra here in this model, but the urethra is another tube that communicates the bladder with the outside. So the urethra, I'm going to show you a picture of the urethra in just in a minute. Notice that we can see here just portion of the pubic bone. Remember, the pubic bone or the pubis is a bone, is one of the three coxal bones. So the pubis bone is this bone here. And if I want to keep drawing here, we're going to have at some point the large ileum and then the ischium. It's just that in anatomy, sometimes we cannot represent the entire bones, but you you should be able to recognize that this is just a little portion of that pubis bone. Now, most of the time also in anatomy, we like to show you organs that belongs to each individual system, but remember that in your body you have all the organs packed together. So I'm going to show you a picture of how this organ system is related with your bones, how they look, and where the bladder is located. The bladder is not in the abdomen, but is in the pelvic cavity. So I'm going to show you pictures of that next, and I'm going to contrast the female and male. All right, hopefully you can see here. Let's just recap a few of the bones that you learned. Which bone do you think is this? Is this the humerus, radius? That is the femur, right? This portion, all this is the coxal bone. See the coxal bone, right? All that. So the coxal bone is formed by three bones, the more superior and large, that is the ilium, right? Of course, I have to cut all this portion was removed in order to see the organs inside, but you can see it here. That will be the pubis and the ilium, and then you can see a little bit of the ischium. Remember, the ischium is a posterior bone, so you might not see the entire bone there. What bone do you think is this one here? Oh, that is kind of unique with all these little holes here. That is the sacrum bone. And then I told you those are the vertebra, and because it's the lower back, those are the lumbar vertebra. So this will be number 5, number 4, 3, 2, and 1. 5 lumbar vertebra. Look at the kidneys where they are located, right? And then we have the ureters that goes all the way down here to the bladder. Wherever you see the ureters attaching to this, that is the bladder. Now, in a male, sometimes these other structure that looks like a circle, like a balloon as well, sometimes you can confuse that with the bladder, but that is the prostate, right? The prostate is not part of the urinary system, it's part of the reproductive system, but you should know that whenever you see another structure, circular structure below the bladder, that is a male because that is the prostate. Now in this you can see the urethra, all right? Urethra is a tube that goes from the bladder, penetrates the prostate, and goes all the way through the penis through outside, right? That is the urethra. Okay, now we have the female. The parts that are hard to look here is this. So we have the uterus. Sometimes can be tricky because you might think, oh, that is the bladder, and then you might think, oh, that is the uterus, or you might think that is the bladder and that is the prostate. So you have to be careful with those four things. Now, in a female, the uterus of the female, that is part of the reproductive system, but always is associated with the urinary system. The uterus is kind of laying on top of the bladder, so that is the bladder. In a female, notice that the urethra is way shorter than the urethra in a male, right? So in a female, urethra is very short, and right behind posterior to the urethra, we have the vagina. The vagina communicates with the uterus. The urethra communicates with the bladder. And this is just for you to practice. The only thing that I'm going to mention here is that if you look these, it's just to help you to orientate yourself where the kidneys are located. This is a posterior view, so we're looking at the back. These are the ilium. This is the ilium. L5, lumbar 5, 4, 3, 2, and 1. And then we have here the thoracic vertebrae. That's T12, T11, T10. Notice that, remember I told you that the ribs, we have the same amount of ribs is the same amount of thoracic vertebra. So this is rib number 12, rib number 11, and so on and so forth. Now the kidneys are at that level. So right kind of the end where you have the last ribs, and that's the function of those ribs, are kind of protect the kidneys kind of against injuries or against any trauma. The ribs kind of protect partially the kidneys. But this picture here is just to show you how low or how high are the kidneys in your abdomen. They're the deepest, one of the deepest organs in the abdomen. And this is the last PowerPoint slide. Here is the reproductive system. With a male, you just need to know two structures, the testis and the penis. We just learned the urinary system, digestive, less skeletal. Let's put that in practice, okay? So here, I'm going to show you some structures. So for example, this in a male, it's going to be the prostate. On top of the prostate, we have another organ that looks like a balloon. That is the bladder, the urinary bladder. Okay, and then from the bladder, we have the ureters. Now, you may see that this ureter has been cut, but if I want to draw it, the ureter will go all the way. This little yellow thing is the other ureter. So that is the right ureter, and this is the left ureter. They go all the way until they reach the kidneys. All right, so the kidneys will be somewhere around there. I mean, higher probably, but just keep in mind that those are the ureters. Now we have here the rectum, and this will be the sigmoid colon. And this portion has been cut, is part of the colon. Let's look at the female now. In the female, so we have the ovaries, okay? And then we have on top of the bladder, this will be the bladder. This will be the bladder, and on top of the bladder, we have the uterus. The uterus, then we have the vagina, which goes out, and then we have the urethra, which goes out as well. All right, you can see here, which bone do you think is this one? That is the sacrum bone. Which is the ureter here? This. Which one do you think is the ureter? Well, the ureter is the one that goes all the way until it reaches the bladder. So the ureter is number 3. That is the ureter that goes there. And that concludes our class on the body organization.